Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. Here we have MRI of the brain. We can see axial T1, T2 and axial flare sequence. This is a complex mass in left posterior parietal lobe which shows cystic component having low signals on T1 weighted sequence and high signals on T2 weighted sequence. Here we see intermediate signals are noted in cystic component, while in posterior peripheral portion of this lesion we see a solid lobulated component which shows intermediate signals on both T1 and T2 weighted sequence, while high signals are noted on flare sequence. Let's see, there is mass effect on left posterolateral aspect of the atria and occipital horn of the left lateral ventricle, while surrounding brain parenchyma is unremarkable, as there is no evidence of edema in this region. Here we have coronal T2 weighted sequence. Bright signals are noted, or high signal intensity signals are noted in the cystic component, and here we see this is a solid component. Here we have post-contrast images. We can see this is axial post-contrast image. Solid component shows post-contrast enhancement. Here we can see there is subtle peripheral post-contrast enhancement in its walls. Here we can see coronal images with similar changes, mild peripheral post-contrast enhancement, mass effect on atria and occipital horn of the left lateral ventricle, while solid component shows significant post-contrast enhancement. Same thing can be seen on sagittal post-contrast images. There is mild peripheral post-contrast enhancement, while lobulated solid component shows significant enhancement, and there is no evidence of surrounding vasogenic edema in this region. Mass effect can be seen on atria and occipital horn of the left lateral ventricle. Here you see midbrain, pons, medulla oblongata, fourth ventricle and cerebellum. All these structures are unremarkable. We can see optic chiasm, mammillary body and pituitary gland. So the differential would be with the pilocytic astrocytoma and pleomorphic xanthoastrocytoma and pylomyxoid astrocytoma. These are all fluid producing astrocytomas, and we do not see surrounding edema in such cases. The possibility of hemangioblastomas cannot be entirely ruled out. However, this requires angiographic correlation to be on safe side for further assessment. Thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.